Fantastic. So, hello, everybody. I am so excited, okay? We have a famous, truly special guest. I'm so glad and lucky to call her my friend. Her name is Dr. Funke Brown. And you're going to find out in a minute why we're so lucky to have her, because I'll tell you, this doctor has been interviewed on ABC. We are lucky to have her. But she's just someone who's just so passionate about a matter that is near and dear to my heart, which is sleep. Okay, so she is a sleep specialist extraordinaire, and she's very passionate about helping people discover the gift of sleep as a superpower. Okay, so this is the amazing Dr. Funke Brown. Thank you for coming.
Thank you so much for having me, Dr. Dada. You have no idea. I'm just so honored to be here and just so thrilled to call you my friend too. You've been such a role model and a mentor, and it's fantastic to get to hang out with you.
Yeah. Well, yeah, thank you for coming. So, I would love for you to introduce yourselves, because you have so many accolades and I don't want to mess it up. So I would love for you to introduce yourself to our guests, our members, people who are watching the show, audience, so that they know who they're listening to, and the authority that they're listening to.
All right, thank you. Again, hi everyone. I'm Dr. Funke Brown. I'm a sleep medicine physician, and I help people really prioritize sleep for their optimal health, because we do know that sleep is key to everything. And so you'll come to find out more about that as we go on. So I've really done this for over a decade now, and it came from a place of me also having struggles with sleep, and having kids and being a professional and being a hyperachiever as a woman. So you just combine all of that together, and what you get is burnout and sleep deprivation. And some of that is what motivated me to pursue a career in sleep. And really then I started to delve into the science, and it was like, oh my gosh, you can't unlearn this stuff. And so that's really become my mission, to help people understand why and how to get the sleep they need, so they don't have to rely on medications, so that their health can be better and their performance can be better.
Okay. Fantastic. So I think with that introduction, I'll introduce myself too. So my name is Dr. Arinola Dada, for people who don't know me. And I help people with joint pain and autoimmune diseases become pain-free and get their immune system back on track, so that they can live healthier lives. And so that's kind of why I think this interview is so important, right? A lot of my patients are dealing with sleep issues from multiple causes, but including pain, right? So I was thinking about this, and I was like, anytime I talk to my patients about sleep, they're looking at me and they're like, I'm here for my pain, right? And I'm like, there is an interaction with lack of sleep and sleep deprivation and pain. So I was like, I need Dr. Brown to come here and help me explain to my patient a little bit about why there is that interaction and feedback loop between pain and sleep. So I was going to ask a little bit more about Dr. Brown. We kind of talked a little bit about kind of your intro, and that you're a nationally recognized sleep specialist with an intriguing career. I love your career. I love your story. Can you tell us kind of who do you help? Who's your kind of ideal? Who do you typically help with the work that you do?
Yeah, absolutely. So I am really on a mission to help busy women and their children. And that's been my focus. But I also work with organizations, right? Because in those organizations are women, our mothers, our parents, and things like that. So for especially people who are so exhausted and have a hard time with their sleep in one way or the other. Either they are getting into bed and they're not able to sleep because, again, maybe they're in pain, maybe it's the worries, maybe it's the kids. So I really help. I'm really passionate about helping those group of people.
Thank you so much for the work, because I'm one of those mothers, I'll tell you. So you know what? Let's get to it, right? And keep people in suspense enough, right? So tell us and tell our audience how sleep affects us physiologically, right? And I think I told a little bit. Anytime I mention sleep to my patients, their eyes are wide and they're like, okay, this Dr. Dada wants to put me on CPAP. That's all they see, right?
Mm.
And I want them to understand, they may need CPAP and they may not. But can you tell us kind of a little bit more about the lack of sleep and how it affects the pain, can affect pain?
Yeah, that's a great question. And so it's, I would call it a bidirectional relationship, meaning that one probably leads to the other, and then it works the same way. So if you have a lot of pain, it's going to affect your sleep, right? Either because you're awake or you're restless or things like that. But then when you have poor quality sleep, it's going to increase your pain threshold. So we know that when we sleep, there are different ways by which sleep can increase, can affect our pain threshold. So the first thing you think about is when you sleep well, when you get restful sleep, what happens is that your body releases growth hormone, right? There's stages of sleep that you have hormones that are released. Now, what does growth hormone do? It's not just for growth in children. It's actually important for healing, repair, and restoration. So when you're in pain, right, it may be that, there's damage at the nerve endings and, the nerve fibers. You may have sustained an injury or you may be ill. So when you sleep well, you get that restoration function. Now, if you don't sleep well, guess what? You're going to lose the benefit of that healing power. So when we are in pain, of course, you want to do medication, you want to do physical therapy, but sleep, you want to have a good diet and nutrition, make sure that, all the appropriate nutrients that will benefit your healing are there. But sleep is actually one of the tools for healing. So that's one. The other way by which sleep can affect your pain in that sense is that your pain perception, right? Your ability to perceive pain, it increases when you don't sleep well. Because what happens is when we sleep, you have release of sort of kind of feel good hormones. We call them endorphins, right? It makes you feel good. It sort of eases your perception of certain things, of hurt, of injury, of pain as well. So that's why you become even more sensitive to pain. So everything seems more intense when you don't sleep well. And then another thing is that so that's two. Number three is when you sleep well, right? It decreases inflammation in your body. It decreases stress, right? What happens when you have pain? You have a lot of inflammation. And now on top of that, you don't have good sleep, then that inflammation response is higher, right? So then the pain becomes worse. And with that, more pain, there's more inflammation. With lack of sleep, you can't dampen that. And so you're in this vicious cycle. I just told you about three, right? So fourth one is that when we sleep well, our emotion regulation occurs, right? We know that sleep is related to our mental health, right? If you don't sleep well, you may end up feeling more anxious. You may end up feeling more stressed. And you may end up feeling more depressed, actually. And there's a lot of literature, there's a lot of research on pain and mood disorders. So imagine that you already have some mood disorders because of your pain. And now sleep, which is meant to heal, sleep is healing. If you're missing out on good sleep, then you're only going to make that even worse. And of course, if you feel anxious and depressed, then your pain feels worse. And it's a vicious cycle. So we can see that there's such a tight relationship between sleep and pain. And thank you for telling your patients when they come to you to sleep well.
Thank you, Dr. Afolabi Brown. I was actually taking notes because this is such an important topic, right? And so let me just recap just for the audience, kind of the four things that we kind of talked about. One is that sleep is important for growth hormone. Growth hormone doesn't just make you tall, it also helps to kind of heal. And so heal is restorative. I will use that term non-restorative sleep. And especially when we talk about, hey, you wake up in the morning and get fatigued. Well, you didn't run a marathon. Why are you fatigued, right? So part of that goes to kind of what Dr. Afolabi Brown is saying, which is, sleep is important for restoration. The second thing, so we talked about growth hormone, healing power of sleep. That was one. The second thing we talked, Dr. Afolabi Brown talked about, is sleep as a natural endorphin, right? And I can say my mood is better when I sleep. And so I think we're less, we're able to tolerate pain better, and the pain is less intense when we have a good quality sleep. The lack of sleep is important again for our patient, especially my patients. We're dealing with a lot of inflammation. And you kind of also mentioned, the importance of diet, but you also mentioned that sleeping is important to reduce inflammation in the system. And so the opposite would be, if you're not sleeping, it can make inflammation worse. So that's the third thing Dr. Afolabi Brown mentioned. And finally, talked about emotions and anxiety, right? If you're not sleeping well, there's more depression. And I'll actually add maybe a little more fibromyalgia, which is when there's so much pain and people kind of feel their depression. So 4 things Dr. Afolabi Brown kind of mentioned to kind of emphasize just how sleep and pain can be interacting. I think that is so helpful, and actually made notes of it so that when my patients are asking, why are you asking me this? I'm going to have these 4 things to really tell them, to kind of bring it home to them. So thank you. That's very helpful. So and then would you mind sharing a story with us about a patient of yours who had an amazing outcome after being in your care?
Yeah, absolutely. So I would say one of the things I love about the work I do is that I'm not just treating your sleep issues, right? Similar to what you do, right? Your patient comes in and says, I'm in pain. You're asking about their sleep. You're probably asking them about exercise. You're asking about different things. So when I am working with clients, I'm looking at it from a very holistic perspective. What's happening at work? How is sleep impacting their function, their ability to parent, especially with busy moms? So maybe one example would be a sort of a pair, like the mom shows up because she's exhausted. And that's what they're telling me. They're not saying, oh, I want you to get me to 9 hours of sleep. They're saying, I want to stop feeling so tired, or I want to just be able to go to bed, fall asleep, and stay asleep. Or I want my little one to stay in their bed so they don't just come to my bedroom and disrupt my sleep. So I had a client who had everything, right? She had issues at work where she was just not performing because she was so exhausted all the time. She had issues with working with her team because she was cranky and moody, and her performance was declining. And, she was taking all that home as well, the frustration with just really working well with her kids and her family. And then her kids were not sleeping. You can imagine at the end of a very long day, all you want to do is crawl into your own bed, but your child is like, come on, give me one hug. There's this and that and the other. So our child was really dependent on her to sleep. And so they were both not sleeping. They were both frustrated. Everybody was angry. And she felt she had no boundaries. So we walked through that. And so I didn't start with I didn't even focus on her sleep yet. We just focused on lifestyle and how to create opportunities for her to be able to, decompress so that when she went to bed, she wasn't carrying all the burdens and all the frustration. And then the other thing we worked on was getting her child to sleep. So we were able to empower her so that she became her kids' sleep coach. And all of a sudden, she was saying goodnight to her daughter. Her daughter was going into her bedroom. She had time to kind of unwind, and then she was able to go to bed. And so within a couple of weeks, with setting those boundaries in place, she was sleeping well, stress level was low, work performance and time efficiency, which was something else that we worked on, was better. And her daughter was independent at bedtime. So, that's why I do the work I do. And, so that's just one example.
Wow, my goodness. Those feel like, I don't even know how many wins in that, for us to even unpack. I'm like, okay, if you are exhausted, if you want to feel rested, if you're having trouble with performance at work, if you're feeling that you're moody and cranky, if you have a little kid jumping into your bed when you're not ready to wake up, if you are feeling so frustrated from all that kind of coming in, Dr. Funke Brown is able to help you become your own child sleep coach, right? And just helping to unpack all those different issues that were manifested in I'm exhausted, I'm frustrated, right? So that's freaking amazing. I am like, wow. She probably didn't even know she probably didn't even know all the issues that were happening to her that made her feel so frustrated and exhausted. She's just like, I'm frustrated, I'm exhausted. I don't know why. And wow, and I think that's kind of the benefit of working with an expert like Dr. Funke Brown, because then you can really unpack and then you find out like, yeah, it's all cute and everything to have that child jumping in my bed, but there's repercussions to that happening. So, and then you even created a sleep coach. That's amazing. I wish I knew you when my babies were young. So let's see. Oh yes. So in our show we love to have our viewers have wins, right? And so can you give me and our viewers like 3 easy tips that we can implement to improve our sleep habits? Please. I'm writing.
Absolutely. So, we didn't go into too much. I know you had mentioned sleep apnea, I think one thing I wanted to mention real quick, especially with, your patients and things, is because of pain, sometimes there's a higher risk of maybe being on medications that can relax their upper airway and make them at risk for sleep apnea. Or maybe they're not moving and they're not as active and they're overweight. That can also put them at risk for sleep apnea. So in those situations, you might need to get tested for sleep apnea, because if you have sleep apnea, then your sleep will not be restorative. So I just wanted to remind people out there that even though we talked a lot about how pain and sleep are related, there are other sleep disorders that can contribute to your pain, so just be aware of that. Now, in terms of tips, I think I'm going to narrow it down into 3, really, especially again for your audience. One is you want to try to increase what you call your sleep drive. What does that mean? You want to build sleep pressure. And really, what is sleep pressure? Sleep pressure is just that capacity and ability to sleep when it's bedtime. And the best thing I would say is, especially again, thinking about the people you see in your clinic who may spend a lot of time in bed because they are in pain, they feel like they have low energy. You need to try to limit the time in bed not sleeping. So use the bed for sleep. So the tip is use the bed for sleep and sex and avoid doing anything else in bed. And we can be creative about how else, even if you're in pain and you don't want to get out, but whatever, we can find ways to work around it where your bed is really, your brain starts to make that association like, okay, I'm in bed. We're supposed to be here to be asleep. I'm not in bed to watch TV. I'm not in bed to have dinner. I'm not in bed to worry, right? So you really want to do that. So that's number 1. The second thing I would say is you want to strengthen your circadian rhythm. And what's that circadian rhythm? It's our internal clock. It's what helps our brains know when it's time to wake up, when it's time to go to bed. And it also serves a lot of other functions in our body. But you want a very strong and well-anchored circadian rhythm. It's really in alignment with our 24-hour cycle. So how do you strengthen that circadian rhythm? Is by having a consistent sleep time and wake up time. So when you sleep and you don't have a set time, your body is confused. It's like, wait, when are we going to bed? When are we waking up? And so that really disrupts a lot of other body functions. So set a time that's consistent and try to stick to it. Have an alarm clock, have someone wake you up. And even on the weekends, you really want to avoid sleeping in for too long. Again, it's tempting. I'll give you just a little time, but not too much time, because many people, maybe they wake up at 6 or 7 a.m. on the weekdays, and then on the weekends, they're sleeping till noon. It causes a lot of confusion in your body, and it makes you even feel worse. And so the third thing is really finding ways to manage stress. So that's a very key tip, because stress causes what we call an increased arousal, such that when you get into bed, that's one of the things you might hear people say, well, I get into bed and my mind is racing. I can't shut my mind down. It's like everything else, all the thoughts keep coming, all the worries keep coming. So find ways to manage stress. And how that would look like will be different for everyone. One of the things, the best tip I recommend to doing that is create a routine for yourself, calming activities before bed, that help you to really wind down, that helps your brain know, okay, we're done for the day, it's time for bed. So those are just the three things. So avoid excessive time in bed, use your bed for sleep and sex, make sure you have a regular and consistent sleep time and wake time, and also manage stress and incorporate a bedtime routine into your rituals at bedtime.
I think that is amazing. And I am going to tell you right now, especially the number two, which is on weekends. I like to just stay in bed till late. So, but you're right, it messes me up during the week, right? If I stay in bed till noon, which is my fantasy and happens once a month or something, when I can really just stay in bed and I'm like, I need to rest. But I think you're right, it messes me up. I can feel it during the week. It's a struggle. So trying to be consistent with your wake and sleep time, and it basically sounds like discipline, right? And it sounds like being disciplined, understanding that you're in bed for two things: sex and sleep. Other than that, get your butt out of bed, right? That's when your TV plays, that's when your dinner plays, and just getting your mind kind of more in tuned to the fact that a little more disciplined, because it pays off at the end, right? And just managing your mind, shutting down. I think that's my second thing is shutting down the mind. And it's not serving you. All those thoughts are not serving you in the middle of the night when they're interfering with your sleep. So do what serves you. Thank you. These are really so helpful. I think it's really going to make a difference. And I'm making notes in my little note journal. I'm making notes both for myself and for my patients, so that we can incorporate these things. Okay, I like to have a fun question on Healthy Joints, Healthy Life Show. And so, what is your superpower? If you had a superpower, which superpower would you wish you had, and why?
Sounds good. So not my current superpower, but a superpower I wish I had, right?
You wish you had, yeah.
I think it would be to be able to read people's minds. I'm sure many people say that. My goodness. You just see the way people behave, the decisions they make, or the relationships you have with people, and or wanting to serve them. And I think if I had that tool, I would like literally rule the world. So I guess there's a reason why it's not my superpower.
I love that superpower. But you're right, I get it often from doctors. It starts from wanting to help to rule the world.
I know, right?
I love it. So yeah, so can you please tell our audience? This was amazing. Thank you so very much. I've learned a lot. One is basically how I can tell my patients a little bit more about that, basically that interaction, which kind of goes back and forth. If you don't sleep well, you have more pain. If you have more pain, you don't sleep well, and how we can work on breaking that cycle, and kind of a little bit of the science behind it. And then the other thing is what we can do. So you gave us 3 points about what we can do about the discipline of sleep, right? And how to make sure your bed is serving you, your thoughts are serving you. So this was so helpful, Dr. Afolabi. I feel like there's so much more to delve into, and we're going to try to get on your schedule again, because I know you're such a busy woman. But for those people who really feel that there is a need, there's so much, I think, so much benefit from working with you. And so from those people who feel that they would benefit from working with you, can you tell our audience how they can find you?
Yes, and it's been just a delight chatting with you. So if you are a woman, a busy woman, or you wear that label, right? Or you are just an exhausted mom, or a high achiever who is tired of being tired, and yet when you get into bed, it's hard to shut that mind down, and you wake up feeling unrefreshed and unrestored, then you should give me a call, because Again, we just kind of scratched the surface in terms of how to really delve into this. And the best way to find me is on my website, www.restfulsleepmd.com. And there you could schedule a free consult call, no, no strings attached at all. And we could talk about how we could work together, how I can help you. And if not, who I would point you in the right direction. And then I also have a YouTube channel where I put out resources every week around sleep health, how to prioritize sleep, and a lot of what we talked about in different ways. And really, it's tailored for moms as well. And then you can follow me on Instagram as well as Facebook at Restful Sleep MD. So those are the three main places.
Wonderful. Well, thank you so much, Dr. Afolabi Brown, for coming on to our show. If you are in the greater Seattle area, contact us at Overlake Arthritis and Osteoporosis or overlakearthritis.com. We have a team that will help you to a healthier version of yourself. Thank you for watching. Remember to subscribe to our YouTube channel at Healthy Joints and Healthy Life with Dr. Dada. And please share this video with someone that you think will benefit from it. And again, if you're a woman, you're feeling exhausted, you're feeling tired, you're not sure what to do, I would recommend you call Dr. Afolabi Brown and let her help you figure out how to get to a healthier version of yourself. Thank you, everybody, for watching. See you next time.
Thank you.